So, for my second topic, I chose safety and trauma literacy because it reflects the type of nurse I want to become, someone who provides care with patience, empathy, and awareness. Through our other courses, we've actually discussed how patients have experienced harm or even died because their emotional distress or trauma history just wasn't recognized. And then week 10 of this course helped me to understand that trauma is far more common than we assume, and that people's behaviors, reactions, and communication patterns are often shaped by past experiences that we just may never know about. So that alone really just made this topic feel essential for me as a future practicing nurse. So the first article I looked at by Cannon et al. Just highlighted that nursing students often feel unprepared to care for trauma impacted patients unless trauma literacy is explicitly taught. They argue that understanding trauma physiology and regulation and communication skill isn't optional, it's foundational to safe practice. This sort of helped me validate how important it is for me as a nursing student to build these skills early on. The second article by Dottle and Speck about trauma-informed care in nursing practice reinforced that trauma is extremely common in patient behaviors and often is reflective of a protective survival response rather than intentional resistance. The article highlighted how nurses play a central role in creating emotional safety and preventing re-traumatization. They do this by building trust through compassion, predictable communication, and awareness of trauma triggers. This sort of deepened my understanding of trauma literacy and made the concepts from week 10 just feel a bit more concrete. So this topic connects with my well-being by helping me understand how my internal state influences the care I provide. Trauma literacy helps me notice when stress, fatigue, or lack of sleep pushes me toward my own edges of tolerance. Recognizing those signs support healthier coping, like grounding or reaching out socially or taking breaks, which ties directly to the 6 pillars of health. And professionally, trauma literacy strengthens the type of nurse I want to become, someone who creates emotional safety for patients. It pushes me to show up not just with clinical knowledge, but with self-awareness, emotional regulation, and a commitment to meeting patients where they are and not where I expect them to be. So, sort of as a lingering question, the one thing I'm still wondering about is how can nurses balance being trauma aware with avoiding assumptions? Um, just ensuring that we recognize trauma responses, but just not necessarily thinking that every behavior is a trauma related response. So, learning about trauma informed care sort of shifted how I understand patient behavior. It just sort of reminds me that what may look like anger or resistance could actually just be a trauma response and not necessarily a personality trait. It just reminds me to approach every patient with empathy and curiosity and just see where they're coming from. And especially as I enter my clinical practices this winter, that'll be very good for me to remember.